My name's Jason Love. I'm from Boulder, Colorado, and I've been a medical cannabis patient for about 5 years now. I use cannabis for my pain and muscle spasms. And I found that about 2 years after my accident, being on heavy narcotics, so opiates of all sorts, I was on tramadol and Neurontin and Vicodin and oxycodone, and the list goes on and on. Over that period of time, I felt like I lost who I was. I was depressed, extremely anxious, I was angry at everything, and really just didn't want to do anything. I didn't perform well at work. And so my life really wasn't where it should have been. The quality of life was unacceptable, really, to me and my family and my friends around me. I found that cannabis really made a huge difference for me. My neurologist and I had a long conversation about 2 years after my accident, and suggested that I try cannabis. And so I started to ingest large amounts of cannabis, large amounts according to the law enforcement later on down the road. But that started to make a huge difference. I was able to decrease my opiate intake and all the other pharmaceuticals. My stomach felt better. I felt clearer in my head. I was able to think. I was able to perform better at work. My appraisals at work got better. And so actually just recently, I've stopped taking all of my pain medications. I'm off of oxycodone. I'm off of Vicodin. I'm off of my tramadol, off of my Neurontin. I don't use the patches that I used to use, and so on and so forth. So these last few weeks have been phenomenal for me. I feel like I'm clearer in my head, and I feel like I can move around more. The pain sucks. The muscle spasticity is okay. It's being mitigated by the cannabis. I do feel better. I can function, but I feel like I am able to have a quality of life which is absolutely fantastic. I know it sounds weird, but it almost seems like it's better now than it was before my accident. And I think it's just because I've learned to live with cannabis as my pain mitigator, and it also helps me get to sleep, which is a big deal. I have muscle spasms through the night, and normally can't sleep with that. But it's really worked out for me over the last 3 years, and so for the last 3 years, I'm still trying to figure out what works specifically. What was really exciting for me at this conference, however, is that we see data now that proves that CBDs are very valuable as a cannabinoid, and that THC, we all know, has some value to it medicinally, but it's not the predominant cannabinoid that I need for myself, at least. And so this is just reinforcing my own experience, my anecdotal data, if you will.